Hi, I'm Jim Sampson, one of the nurse practitioners in the ID clinic. Welcome to our self-guided tour to completing the ADAP application form. Now, anyone who has HIV knows that the medications that are taken daily are essential to maintaining good health. And anyone who has HIV also knows that these medications are expensive. We're fortunate to have both federal and state government assistance to help our patients pay for these life-sustaining medications. The goal of this presentation is to help you fill out as much of the application on your own so that the form can be presented to our financial screener or case manager for review, final signatures, and approval. This will speed up the approval to get your medications and also see if you're eligible for other assistance programs provided by the state of Colorado. The AIDS Drug Assistance Formulary is a listing of medications covered by the AIDS Drug Assistance Program. It is an extensive list of all HIV medications, antibiotics, anti-epilepsy drugs, psychiatric medications, diabetes medications, cholesterol, tuberculosis, blood pressure, hepatitis C medications, and many others. This list of drugs is different from state to state because different states fund these programs differently. Colorado is very generous with what is covered on this formulary. If a specialty drug is needed that is not on the formulary, a prior authorization can be done by your provider for an exception to be made. And because the formulary has more than just HIV medications on it, the name of the formulary has been changed from ADAP to Sdap, which stands for the State Drug Assistance Program, and takes into account the fact that so much more than just HIV medications make the list. In order to qualify for the State Drug Assistance Program, there are 3 specific criteria that have to be met. First, you have to be a Colorado state resident. Second, you have to be a person living with HIV. Third, your income must be less than 500% of the federal poverty level for 2020. That means for a household of one person, you cannot make more than $63,800. This is in gross or pre-tax dollars. The Sdap application has to be completed twice yearly, once on the last day of the month you were born in, then 6 months from that date. This is a federal law, not the pharmacy trying to give you a hard time. The reason for a twice yearly recertification is to make sure that a person is eligible to receive these medications and that there's no other pay source, such as insurance from an employer. Without this paperwork, the pharmacy can't give you the medications because they won't be paid by the state of Colorado. So it's a good idea to put a reminder on your calendar for this paperwork to be completed. Now, suppose you have insurance from an employer, or you have Medicaid, or you have Elevate from Denver Health. The Sdap program can help you out here too. Your insurance program will pay for the medications, but it's common for these programs to have a copay, which is a small charge for each prescription. Sdap can pay for these copays, so you walk away from the pharmacy with your medication at no cost to you. This is a good reason to complete the twice yearly Sdap application. Just when you thought that Sdap only helped out with your pharmacy bill, did you know that Sdap can also help pay for several other services and programs? These are an alphabet soup of acronyms, but well worth investigating with your case manager or financial screener. It might save you a lot more than just money on a pharmacy bill. The first program is called Hmap, or Health Insurance Assistance Program. If you have private insurance, say from an employer, or if you've purchased insurance on the marketplace through Obamacare, or if you have COBRA, this program can help pay for your medical insurance premiums, any copays, coinsurance, and deductibles. The second program is called Hmap, or HIV Medication Assistance Program, and is for uninsured individuals to receive financial assistance to pay for HIV medications. If you qualify for Sdap, this program is automatic. The SWAP program, or Supplemental Wraparound Program, is for those on Medicaid. This pays for medical visit copays and prescriptions on the Sdap formulary. And finally, SPAP, or the State Pharmaceutical Assistance Program. It's also known as BTGC or Bridging the Gap Colorado. This is for those people who have Medicare Parts C and D. This program provides financial assistance for Medicare Part D and Medicare Advantage Part C programs for Sdap formulary medications. As you can see, there are many services and programs available, and we know it's complicated. Talk to your case manager or financial screener who can help you figure out which programs you qualify for and how to sign up. Okay, let's get into the form. Remember to print legibly in large block letters so that there won't be any errors in transcription. The first page is a lot of demographic information, such as who you are, where you live, how you're housed. So on line 1, print your legal name. Last name first, then your first name, then your middle initial if you have one. Line 2, what's your date of birth, and put it in the format indicated. The month, followed by the day, followed by the year. Line 3, what is your gender identity or preference? Then, what was your gender at birth? Line 4, what's your ethnicity? There are 2 choices, non-Hispanic versus Hispanic. If you identify as Hispanic, they would like that refined a little bit more. Do you identify as from Mexico, Puerto Rico, Cuba, or other? Just put Latinx if you prefer not to say. Line 5, race. Check all that apply. Line 6, put in your 9-digit social security number. If you don't have a social security number, put in NA. Line 7, indicate your current relationship status. Line 8, what's your preferred language? Line 9, indicate your housing status. Line 10, what is your street address? You can't use a P.O. box here. And after your street address, they want city, zip code, and county. Line 10 becomes important because remember you have to be a Colorado State resident to receive Sdap. Now, how do you prove that you're a Colorado State resident? Any one of the following items will work. First, a Colorado driver's license or a Colorado identification card, and it has to have your address on it. Second, a mortgage or a lease agreement. Third, an electric bill. Next, a cable or a satellite TV bill. Unfortunately, a cell phone bill will not work. Next, a water or a sewer bill. Next, a landline phone bill. If you are homeless, a letter of support from your case manager will work. If you do not have any of these documents, but live with someone who basically provides for you, that individual can sign an affidavit. And this is a form that is signed by both you and the individual who supports you. An example of the affidavit form is at the end of this presentation. Line 11, if you don't receive mail at your street address, where do you receive mail? It's okay to use a P.O. box here. Line 12, what is your phone number? If you have a cell phone with voicemail and text message capabilities, it's a good idea to list it as reminders can be sent to your phone. If you don't have a phone number, it's okay to leave this blank. Line 13, put in your email address. Again, this is a great way to get reminders about important programs. Your email will never be sold to third parties or shared without your permission. Line 14, even if you give your email address, you can opt to not have email reminders sent to you. If you would like email reminders sent, a new Sdap application can be sent to you through the email. If you opt to receive an email reminder, you will not receive an application through the regular snail mail. Line 15, since the Sdap application is so important to fill out and submit twice yearly, you can identify a personal contact. For example, a family member or a friend who can get a reminder message to you in the event that your email or phone number isn't working. You can also elect to leave this blank. Line 16, case managers are great people to have on your team. They're informed about the latest laws, regulations, and programs that may benefit you. You do not have to have a case manager. If you do have a case manager, please list that person here. Line 17, Did you file taxes last year? If you did you file as a single individual, as a married, divorced, or legally separated individual? This is important as a proof of income. Line 18, how many adults and children live in your household? Line 19 wants to know the reason you didn't file taxes. This is important again for income verification. Line 20, when were you first diagnosed with HIV infection? Guessing or estimating is okay. Remember, only those who have an HIV diagnosis are eligible for Sdap services. Line 21, have you ever been told by your medical provider that you had an AIDS diagnosis? Line 22, have you ever been told that you have hepatitis C? This is a common co-infection with HIV and is treatable with medications. Sdap pays for these medications too. Line 23, where are you receiving your HIV care? Is it at Denver Health? Is it at another clinic, such as university, or from a private medical provider? Please list where you are receiving your HIV care. Line 24 wants to know if you are enrolled in Colorado Medicaid. Remember, Colorado is one of the states that expanded into Medicaid under Obamacare. It is excellent insurance and covers many services and medications. If you are eligible, your case manager or financial screener will be able to help you apply. If you were on Medicaid in another state, you have to disenroll in your former state to enroll in Colorado Medicaid. Of note, Medicaid will include limited dental coverage in 2021. Line 25 wants to know if you're on Medicare. Medicare is a federal health insurance program for those over 65 or those who have verified disabilities. Generally, Medicare is divided into two parts. Part A covers hospital charges, and Part B covers outpatient clinic charges. There is also medication coverage called Part D, which is optional. As with many insurance programs, there are copays and deductibles that must be met, and an Sdap program called Bridging the Gap Colorado can help with these Medicare Part D charges. Line 26 wants to know your employment status. Line 27, are you only recently employed, say within the last 90 days? Why is this important? Because employers report employees who are insured to the state. Sometimes it takes the employer or the state some time to report your employment status. Line 28, does your employer offer health insurance? Remember, Sdap does not cover medications for those with health insurance from their employer, but Sdap will cover copays. Line 29 wants to know if you are enrolled in insurance through Connect for Health Colorado, which is Obamacare or the marketplace insurance, such as Denver Health Elevate. Line 30, are you enrolled in insurance that is not through the marketplace? Perhaps you purchased your health insurance directly from an insurance provider. Line 31 is about proof of income. Remember, there's a maximum amount of money you can earn based upon how many people live in your household. This gets technical, and honestly, this part is best done with your financial screener or case manager's help, so they can explain what documents are needed and how best to fill them out. But you will need to bring certain documents to this meeting for proof of income. Your application cannot be submitted without these documents, so come prepared. If you do not have insurance, or if you are undocumented, you must bring a copy of 1 month of paycheck stubs from your current job. These must be less than 6 months old. Or, if you filed taxes, a copy of the first 2 pages of the 1040 tax form from the IRS for the most current year. Or, if you are supported by another completely, a statement of support must be supplied. This was the affidavit that was mentioned earlier. If you are receiving Medicare, please bring your current Social Security award letter and proof of any other income from job, pension, annuity, or private retirement, or if you filed taxes, a copy of the first 2 pages of the 1040 tax form from the IRS from the most recent year. If you have insurance from an employer, or if you have insurance from the marketplace, please bring a copy of the first 2 pages of your 1040 tax form from the IRS from the most recent year. And if you have marketplace insurance, please bring IRS form number 8962, which is the premium tax credit form. Next, what is Sdap going to do with your information? Providing HIV services is a team effort, from your medical and dental providers to case managers to the pharmacy. Everyone has a great interest in keeping you healthy. You can give Sdap the okay to share specific information with your other HIV service providers or case managers, or you can say no to sharing any of your information. But if you leave this box blank, that is the same as saying you want the Sdap program to share your information. Sdap is run by Ramzel, a pharmacy benefits manager. When your Sdap is completed, you will receive a card in the mail. This card acts as proof of HIV positivity for any clinical services or for HIV case management. Finally, sign your application. Bring all the pages of the application to your case manager or financial screener. The final page of the application is an affidavit or statement of support, and this is only needed if you cannot provide proof of residency in your name or if you report 0 household income. In that case, Sdap would like to know how you support yourself and who supports you. Both you and the person who supports you must sign the form, and the person who supports you must provide proof of domicile, such as a driver's license or one of the other documents mentioned earlier in this presentation. Thank you.